Get ready to listen, learn, and earn CE hours. This podcast features content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits.
Welcome back to Cardiac Rehabilitation, the nurse's integral role in heart recovery. I'm your host, Dr. Candace Pierce, and I'm excited to continue this discussion with Erin Hill. Thank you for continuing this discussion with me, Erin.
Yes, thanks, Candace. I'm so happy for this opportunity.
Absolutely. I can hear your passion for just sharing this area that you just love and the patients that you work with. So I can just see it in you.
Yeah.
If you joined us for our last episode, you heard some incredible stories and insights about the challenges and rewards of working with cardiac patients. So for this episode, we're going to shift our gears a little bit and we're going to focus on some practical strategies and best practices in patient care. So Our goal, Erin and I's goal, is that when you walk away from this podcast, you're going to have some valuable tips on how to support your patients physically and emotionally. And we'll also talk about how to effectively communicate and collaborate with other healthcare professionals and overcoming some common barriers in rehabilitation. You ready to dive in, Erin?
Yes, I'm super excited.
Awesome. Okay, so in your experience, what are the most important aspects of physical recovery for patients after a heart-related event?
Well, definitely with cardiac rehab, obviously, we're focusing mostly on the physical aspects, so the exercise. Um, the current guidelines that the American College of Sports Medicine recommends are at least 5 days a week, 30 minutes of exercise. So patients, most of the time, they're coming to us 3 days a week, 30-minute, exercise during our hour-long sessions. So we encourage them on the days that they're not attending, maybe on a Tuesday, a Thursday, or over the weekend, get out and walk, 15, 20 minutes. Start off with that. But eventually we would like to see them work up to that full 30 minutes. A lot of them too are interested, even before they're done with us, are interested in joining like a gym or doing something else, outside of their home. So we give them a lot of those resources as well too. So in addition to the physical side though, their psychosocial, their anxiety, their depression, helping them recover from that. And also too, we focus on their nutrition, and especially if they have diabetes too, how to manage their blood sugars and just, right food choices. We, some programs are very blessed to have a dietitian on staff. We do not, but we do have inpatient dietitians who come to our department once a month and they teach like a group nutrition class for our patients. And it's free. We don't bill for that at all. But also too, if the patient does have diabetes, their insurance would cover for them to do like a one-on-one with a dietitian as well. So we can refer them to that. But those are the main ways that we help support them in their recovery for sure.
So in episode 1, and just now, you've really mentioned the anxiety and the depression that these patients usually come to you with after a cardiac event. So how do you effectively address the emotional and mental well-being of these patients?
Yeah, absolutely. I know, and I mentioned before in the first episode as well, just how prevalent it is after a heart event. The patient may have never struggled before with anxiety or depression, and all of a sudden they're experiencing these new emotions. So we use that screening tool, the patient health questionnaire. It's a 9-question screening that we use. And if they score moderate, severe depression, we refer to usually their primary care doctor and just let them know. And we go over with the patient too, their score, and what they're doing at home to manage those emotions. We discuss, relaxation techniques. So things like deep breathing and meditation. A lot of people have those sorts of practices already in place. Some of them don't. But even to things like yoga or listening to music, walking their dog during the day, that can definitely help as well. And also too, we can discuss with them attending talk therapy, like with a psychologist or, a mental health professional as well. We can also refer to our pastoral services in our hospital, and the patient, they usually have other resources too that they can give to the patient. And then also too, I frequently see when patients come to us, some of them may have been prescribed, an SSRI and,
Mhm.
another depression medication, but they are scared to take it. So, giving them that education on that particular medication as well,
What is
will
usually their
usually
reason for being scared to take it?
I think they're worried that there may be some addictive properties, or a lot of them just don't like how they feel when they take those medications. They usually have a lot of side effects too. So,
Mhm.
I'm discussing that with them and discussing, there's different dosages that the doctor can use. So, we definitely encourage them to discuss with their doctor if they're experiencing any side effects while taking these medications. Um, that's usually, yeah, the concerns with those.
Yeah, I can totally understand those.
Mhm.
So, what are some strategies that you use to ensure patients are really understanding especially the new medications that they come to you with and all of these lifestyle changes? There's a lot of lifestyle changes that really need to happen with cardiac events, typically, tip for a
Yeah.
typical patient.
Mhm. Yeah, absolutely. So, when they come to us for their initial assessment, we always go through their medication list with them. My particular facility uses Epic, so we do medication reconciliation in Epic too. And it's nice because with the system, we can print off like written materials and handouts and things for their, medication education. Um, and also too, the good old teach back that
Yes.
we do all the time with our patients too, and discussing that, with them and seeing how well they know, their new medications and understand those. Um, but yeah, as far as, like, lifestyle changes and things, just, uh, education is huge for that.
How long does it usually take for them to really start to put those lifestyle changes into play?
I think, usually by the time they're done with us, we have them, 2 to 3 months, 36 sessions. I think by that time, they're really feeling a lot better about the changes that they're making and more confident.
Yes, because I mean, for some patients, that's a complete overhaul of everything they've eaten, the way that they have
Yeah.
lived. So I mean, they're going to come completely.
Yeah. Yeah, it can be very overwhelming for them,
Yes.
but just the fact that they're coming to us consistently and we're doing education with them every session. It's not just like a one-time thing and we're done with it, but constantly educating them on, watching their weight at home, and especially if they have heart failure, monitoring that and, yeah, their nutrition, their salt intake, and teaching them, how to check their blood pressure at home too, especially if they're taking blood pressure medication, and monitoring all those numbers, their blood sugars, all those things too, just constantly educating them.
And you said it can be overwhelming. So how do you help
Mhm.
them overcome the sense of just being overwhelmed with everything?
Yeah, a lot of that honestly is education and just trying to, I guess, get a better understanding of their knowledge of their condition too, and assessing that, and, whatever barriers or whatever lack of knowledge that they may
Mhm.
have, addressing those things as well. Um, and then too, like, with their attendance, there's so many barriers that can come up, like I mentioned in the first episode, transportation needs, financial,
Mhm.
um, and then too, what if they're very depressed, that can be a barrier as well. If they're still smoking, that can be a barrier, so addressing those types of things with them too. Um, and then when we're doing these, assessment and all these things on their needs, we come up with a plan for their risk factor, modification. So if they have high blood pressure, most of them do. We're talking about, checking it at home every day, coming up with a goal for the patient. And it doesn't have to be anything, drastic. Even let's say they weren't checking their blood pressure at all. Even just that goal of I'm gonna check it at least once a day in the morning before I take my medication, something like that. So coming up with a goal for each risk factor, so their smoking and their nutrition and their diabetes and those sorts of things too. And we use a lot of those motivational interviewing techniques too in our rehab program, and I can discuss that as well. Um,
Yes,
but
absolutely. And
yeah.
I know you're talking about goals. And so, when I teach my patients, it's usually we're going to start with some smaller goals, and then we're going to
Mhm.
use these smaller goals as jumping off points for the goals that are going to completely change your life. Pretty much it is what would happen in cardiac rehab. But
Yes.
to kind of limit that feeling of being
Mhm.
overwhelmed, and to limit the feeling that you're going to fail.
Mhm. Yeah, yeah. It's yeah, just giving them that support and that confidence, and like I said, every day discussing that with them and assessing, what how are you feeling today, and making that observation with them. And maybe they'll be like, "Yeah, I'm not feeling great today," and reflecting that back to them, it seems like you're feeling down today. Um, and just, normalizing their behavior too. A lot of them feel like they're alone on this island, but just reassuring them, maybe I, as a nurse, could say, I've heard a lot of my patients say that they're struggling with depression symptoms, or they're struggling with all these lifestyle changes after their hospital admission, and validating how they're feeling that and asking them, how they're managing those things at home.
So, looking at collaboration, because I know in episode one, you really kind of listed off a lot of those healthcare professionals that you would get to work with. So, what does it
Yes.
look like to collaborate with you said physical therapist? Do you have like
Mhm.
social workers
Mhm.
too? Because I know you mentioned case management.
Yeah, most rehab programs don't have social workers on staff, but we can definitely refer, um, either through their primary care doctor's office, or even reaching out to the inpatient, case management department as well. But nurses, most cardiac rehab programs have a nurse on staff. Most of them also have exercise specialists on staff who focus mostly just on the exercise aspects of the patients, and the disease process and those sorts of things. We also have respiratory therapists who are available too, because unfortunately, a lot of our heart disease patients also have COPD and other pulmonary comorbidities as well. So collaborating with them and teaching the patients, how to use their inhalers and things like that. With physical therapy, they are definitely very helpful if the patient is still very deconditioned after their hospital admission. Sometimes they may not be ready to participate in cardiac rehab quite yet. So we can refer them to physical therapy, like outpatient physical therapy. And also too, a lot of our post-op patients, there's all those sternal precautions and things after their CABG or after their valve that we have to abide by. So collaborating with PT with, those sorts of things too, and just staying up to date with those, that can really help a lot. Um, but yeah, sometimes too, we also can utilize the outpatient pharmacy, as well with like medication education too, which is nice. Sometimes they'll teach education classes with the patients too. And like I mentioned with the dietitians, we can collaborate with them. Sometimes they'll do like cooking classes as well the patients can
Oh,
attend. So yeah. Mhm.
that sounds fun. I want to come to some of
Yeah.
those.
I know. It is. They're such a good time. The patients love it.
What are some other valuable community resources that are around to support patients during this recovery journey?
Yeah, absolutely. So we can refer them to, like I mentioned earlier, some local gyms. A lot of patients will be interested in that, even exercising outside of the rehab. And yeah, we encourage that for sure. But also, too, if they're elderly, which most of our patients are, they're in that 60 to 80 age range. A lot of like the different area agencies on aging can also offer support. Maybe if the patient still needs assistance at home, like with a home health aide, or transportation, like I mentioned, is a big barrier. So those types of agencies can really help. And, obviously the independent transportation companies using them. And then too with other community, like support groups, Mended Hearts is, I believe it's through the American Heart Association. There's a lot of different local chapters, and it's all support for patients that have experienced a heart event or who have heart disease. And um, I know with my local chapter, the meetings are held through Zoom, so it's not even like the patient has to be able to organize transportation, and so the patient can attend through Zoom, their family members can attend as well. And then also too, I mean, the American Heart Association, they're a great organization as far as support and even just online with their recipes and their exercise guidance and those sorts of things too. We can refer patients to all those.
That's a lot of resources that are around that
Yeah, mhm.
to look into. So I want to go back to where you were talking about motivational techniques, motivational interviewing techniques. Can you kind of
Yes.
break down some of those to how you use them to encourage your patients?
Yeah, absolutely. So our big priority with cardiac rehab is behavior change, and that's long-term behavior change, not just while they're in our rehab program. So, like I mentioned, assessing their current knowledge and figuring out which of their health, needs are their biggest priority, and discussing them with them, what the modifiable risk factors are for maybe their high cholesterol or their high blood pressure, discussing those
Mm.
things with them. Um, Trying to gain an understanding, what does the patient know about the connection between their behavior and the risk factor? And then assessing, what does the patient value about that particular behavior? We get a lot of patients maybe, with their religious or their cultural beliefs, it can affect their eating habits and different things like that. So trying to really understand that and gain that knowledge, about the patient. And then, obviously asking the patient, "Do you feel like you're ready to make this change?" And, I like to ask on a scale of 1 to 10, how ready are you to make this change? And what would it take, like, if the patient answered, maybe they'll say a 6 out of 10 for, let's give an example of quitting smoking. How can I make that 6 move to, like, a 7 or 8? What would it take for that to take place? Um, do they feel confident to make that change on a scale of 1 to 10? And maybe they'll say that it's a 4 for quitting smoking. How can I make that patient move that 4 to a 5 or a 6? And then, asking them what their biggest barriers are to this particular behavior change. So with the quitting smoking, maybe they're having a, stressful time at work, or they're going through a lot of life changes with their family as well. So going through those barriers, and then, coming up, we're with cardiac rehab, we're big into, I don't know if you've heard of the acronym SMART, for SMART goals. So specific and measurable, achievable, realistic, and then time oriented. So even with that, just we come up with like a big overall SMART goal for our program, but we're also looking for each individual risk factor too, setting a small, achievable goal that they can accomplish even before their next session with us too. Um, so maybe with, their, if they're having a lot of anxiety, depression, just
Mhm.
encouraging them, maybe before your next session, just say hi to 3 people, 3 strangers, 3 people that you don't know, or, reach out to an old friend and see how that affects, your depression and the way that you're feeling. So goal setting is just so imperative in our field. And honestly, in nursing as a whole, it really, yeah, is huge. So the last thing I'll mention is, how are they going to measure their behavior change? So with their quitting smoking, we actually have a screening tool that we use for that, and I'm just using smoking as an example because it's easy. But, one of the questions on that screening tool is, how long does it take you when you wake up first thing in the morning to the time where you smoke your first cigarette?
Mhm.
And for most patients who are very addicted, it's within the first hour. So discussing with them, maybe if you can wait maybe to midday before you smoke your first cigarette of the day. That's something that they can measure, over the long term too, and that will help them, to be more successful with that. And then obviously, people are simple. We love rewards. So
Yes, we
rewarding,
do.
coming up with different, and these don't have to be big, even just, I'm going to go out and buy myself a new pair of like running shoes or something along those lines, rewarding your
Mhm.
progress when you accomplish those things.
Yes, because I know, like, a lot of times when people are on diets, they look forward to their cheat day, like, that is
Yes.
their
Yeah.
reward. If I can make it 10 days eating healthy, then I can eat a piece of pizza on day 11.
Yeah, absolutely.
There
Yeah.
is a
So, yeah, it keeps them motivated too, just having those small rewards in the back of their head.
Absolutely.
Mhm.
So when you're talking about some of these barriers that you see, what are some strategies for helping them overcome barriers that kind of keep them from adhering to their medication regimens and their lifestyle modifications? I know we were talking
Mhm.
about motivational interviewing, and you mentioned,
Yeah.
like rewards, but as far
Yeah.
as
Yeah.
the nurse in cardiac rehab, what are some of those strategies that you use?
Yeah, like I mentioned before, just assessing initially their current knowledge, their needs, even their home environment too, and how that's gonna affect
Mhm.
their ability to make all of these lifestyle and behavior changes, and their family support too. Is their family, are they on board with all these
I
things,
was
or,
just thinking family because I feel
yeah.
like
Yeah.
family sometimes makes it harder for people
Yeah.
who have to make these huge lifestyle and behavioral changes.
Mhm.
So that seems like
Mhm.
a really
Yeah.
big one. So, especially with family support or lack of family support,
Mhm.
how do you overcome that type of barrier?
Yeah, just trying to get the family involved as much as possible and encouraging the patient to, bring their family in. It's, you know, it's so nice when the patient does bring their family to the sessions because when we're doing education with them, they're able to also receive that education. They're able to see what the patient is doing while they're with us as well. Um, but yeah, the other, barriers are, just encourage that objective measurement of monitoring their progress towards their goals, either like with workout logs. A lot of times too, the patient will have like a smartwatch. Apple Watches are becoming so
Mhm.
prevalent nowadays too,
Yes.
and the Fitbits, yeah. So we definitely love to encourage that and self-monitoring of those things. But yeah, behavior change is a collaborative process involving the family and, yeah, loved ones, yeah, for sure.
What have you seen success with patients who can't, like their families just refuse to be a part of their journey?
Yeah, on occasion, yeah, and that can be definitely challenging, and especially if the patients score higher with the depression screening. There isn't a whole lot, unfortunately, that we can refer to, um, usually just their doctor. Some people, that's their only support. It's hard to see that. I shouldn't say a lot, but some patients are very socially isolated and, they may not have any family members nearby. Sometimes they have a close friend who's their contact or their support person. Um, but yeah, that is challenging. I wish I had a better answer, honestly, to address
Right.
those concerns, but just, yeah, doing the best that we can as nurses too to support that patient with their journey and their health recovery and giving them, when they're done with us, giving them the resources to continue and
So we know depression and anxiety, as we've said, you usually see those with patients who've had cardiac events. And that
Mhm.
you've already done your screening, and maybe later on when they're working with you, you start to see what are some of those early signs of depression and anxiety that we would look for from someone recovering from a cardiac event.
Yeah, definitely. A lot of times I'll hear from people, they're not sleeping good at night. They're sleeping an excessive amount of time or they're not, their sleep is disrupted and they may have concurrent insomnia, something along those lines. That's definitely a warning sign. But also too, we like to ask the patients, what hobbies or activities do you enjoy at home? And a lot of them will, they'll give us a list of different things. And we ask them too, like how those things have been affected because of their heart event. And if they're not feeling like doing those things that they used to enjoy, that's definitely a big sign that they may be experiencing some depression too. They may have an inability to focus on just small things like reading a book or watching TV. They may feel really distracted. They may feel like they've let down their friends or their family. So those are kind of the warning signs. And especially, it may be that they only experience those feelings, once or twice a week, but if they're experiencing those things every day, that's something that needs to definitely be addressed by their primary care provider.
Absolutely. Do you typically refer them? Do you contact their provider?
Yeah, for sure. Yeah. Yeah, we do. Either we can contact them directly through our EMR, or sometimes if they're not in the same, network, we'll send them a fax or we'll call their office directly and just tell them the patient screened high on this and they're experiencing these different symptoms as a result of that. And also too, especially the last question on the screening that we do asks if they've ever had thoughts of self-harm. Um, and if they answer positively to that, I mean, there's definitely more that we delve into with that, and we refer them, and especially if they have a current plan. I mean, obviously, that's an emergency situation, but, yeah, for sure, and it's very nice. Sometimes they already have, like, a psychiatrist that they've been referred to, so that's also helpful if that's already happened.
Absolutely. So,
Mhm.
what are some of the emerging trends or developments in cardiac rehab and patient support?
Yeah, I'm so excited about this. Currently, the American Association for Cardiovascular and Pulmonary Rehabilitation, they are working on legislative approval for home-based and virtual cardiac rehab. So that was something that it was more prevalent during COVID and the
Mhm.
shutdown and everything like that. And it was actually being reimbursed during that time. But since the health emergency has ended, that reimbursement is no longer taking place, and a lot of those patients, they can't participate anymore, and also too, if patients live in a more rural area,
Mhm.
that lack of, that distance to participate. So working on approval for that, home-based and virtual cardiac rehab, and also too, I mentioned in the first episode, cardiac rehab programs are required to be hospital-based programs if they wanna get full reimbursement. So, there's also working on legislation to approve, doctor's office or, other outpatient building, rehabilitation settings, and making sure that the reimbursement is equal for that. And also too, it's there's this mentality that the patients need to, constantly be on telemetry and that we always have to monitor the heart rate and rhythm. And I think that's great for the first few sessions, but a lot of rehabs are moving their patients off of continuous telemetry and onto more of, just monitoring their heart rate through like a wristwatch
Mhm.
or yeah, some sort of heart rate monitor. So that's also something that's up and coming as well. We're moving moving off of that, continuous monitoring. And also too, there are actually some rehab programs that are looking at like art therapy and mental performance and those sorts of things too, to also help patients in their recovery and just how that can help with our mental health. So it's so neat to see
Absolutely.
that holistic approach to rehab.
So,
Mhm.
I had a podcast that was done not long ago, and it was about music. It was about using music as
Mhm.
therapy. And so, when you were mentioning the
Mhm.
art therapy, it had a lot of really good research to show even just how music can be beneficial.
Yes. Yeah, yeah, absolutely, and even just bringing, like, some coloring pages into the
Hmm.
the rehab setting for patients to use maybe right before or after their session too. It's that sort of thing. It's just amazing. It may seem insignificant, but it really can make a difference over time for the patients.
Absolutely. So,
Mhm.
what advice do you have for nurses who maybe want to specialize in supporting heart patients who have had heart-related events?
Yeah, definitely. If someone really is looking into becoming like a cardiac rehab nurse, definitely some acute care experience is required. It's preferably like telemetry experience. In the inpatient setting, like I mentioned, educating those patients on their medications, and even starting a home walking program right after discharge. Nurses who are further interested, case management experience is helpful too with nurses who may want to start in cardiac rehab. And then joining, like I mentioned, our governing bodies, American College of Sports Medicine and the American Association of Cardiovascular Pulmonary Rehabilitation. They hold conferences, they have memberships through their website, and hold a lot of continuing education on their own too. So getting involved with that and just learning more about that field. And even too, I mean, I'm sure a lot of the nurse managers and nurse leaders would be very open to having someone
Mhm.
interested shadow in the department as well and seeing what cardiac rehab is all about.
Those are some great ideas for people
Mhm.
who are interested in cardiac rehab. So that wraps up our series on cardiac rehabilitation. Over these last two episodes, Erin has really walked us through some experiences and challenges that nurses face in cardiac rehabilitation, sharing some inspiring stories of her patients and really discuss some practical strategies for patient care and support. So, Erin, thank you so much for taking time with us today.
Yes, thanks, Candace.
So, we know that heart disease is the leading cause of death for both men and women in the United States, accounting for one in about every four deaths. So, the work that nurses do, like Erin in cardiac rehabilitation, is critical because it's not just about recovery, it's about giving patients a new lease on their life. To our listeners, thank you for joining Erin and I today. I hope that you're walking away with some valuable insights and practical tools to really enhance your practice, to really keep inspiring and keep caring and keep leading the way in heart health. Don't forget to subscribe for more episodes on topics that matter to nurses. And if you have not already, I really encourage you to explore many of the courses that we have available on elitelearning.com that will help you grow in your careers and earn CEs.
This podcast featured content from an accredited CE activity provided by Calibri Healthcare. Visit elitelearning.com/podcasts for accreditation and disclosure statements and instructions on how you may be able to earn CE credits. Take your learning to the next level by subscribing to more podcasts on compelling healthcare topics.